Samantha, a 29-year-old veterinary technician, received a phone call about medical debt that would test her understanding of healthcare billing and teach her valuable lessons about medical collection scams. The caller claimed she owed thousands of dollars for emergency room treatment she had never received and needed to pay immediately to avoid credit damage. Samantha had excellent health insurance through her veterinary clinic and maintained detailed records of all her medical appointments and treatments. She visited her regular doctor for annual checkups and had not been to any emergency rooms or received any major medical treatments that would result in large outstanding bills. Samantha was careful about her finances and always paid her medical bills promptly when she received them. She had never received any bills or insurance explanations of benefits for emergency room treatment or any major medical services that would account for the debt being claimed. The caller, who identified herself as medical billing specialist Karen Davis from Healthcare Recovery Services, claimed that Samantha owed $4,200 for emergency room treatment and diagnostic tests that had been provided 6 months earlier at Regional Medical Center. Ms. Peterson, you have an outstanding medical debt of $4,200 for emergency services, including CT scans, blood work, and physician consultation provided at Regional Medical Center on March 15th, Davis said with apparent medical billing knowledge and specific service details. Davis claimed that Samantha's insurance company had denied coverage for the emergency room visit due to policy technicalities and that the hospital had referred her account to their medical collection agency for immediate payment to prevent credit reporting and additional collection fees. Ms. Peterson, medical debts can seriously damage your credit score and affect your ability to obtain loans and financing in the future, Davis continued with apparent credit consequence knowledge and medical billing expertise. We're authorized to offer you a one-time settlement opportunity of $2,500 if you can resolve this matter today. Davis explained that immediate payment was necessary to prevent the medical debt from being reported to credit bureaus and that additional collection fees and interest charges would be added if payment was not received within 24 hours. Samantha was confused because she had no memory of visiting Regional Medical Center or receiving emergency room treatment, and she was certain she would remember such significant medical care and the associated costs. I don't remember being treated at Regional Medical Center, and I haven't received any bills for emergency room services, Samantha explained to Davis. Can you provide me with detailed information about what services were supposedly provided and why my insurance didn't cover them? Davis became evasive when Samantha requested specific service information, claiming that detailed medical billing information couldn't be discussed over the phone due to HIPAA privacy regulations, but insisting that the debt was legitimate and required immediate payment. Ms. Peterson, due to patient privacy laws, I cannot discuss specific medical services over the phone, but I can confirm that this debt is valid and needs to be resolved immediately, Davis explained with apparent regulatory knowledge and privacy protection procedures. Davis also claimed that the medical debt collection process was accelerated for Samantha's account and that she had only hours remaining to take advantage of the settlement offer before full collection proceedings began. Samantha felt concerned about potential credit damage but decided to research the medical debt claim independently before making any payments to Healthcare Recovery Services. Samantha contacted Regional Medical Center directly to verify whether she had received any emergency room treatment and learned that she had no patient records or outstanding balances at their facility. Samantha also contacted her health insurance company to verify her claims history and confirmed that no emergency room claims had been submitted or processed for her policy in the past year. Samantha realized that Healthcare Recovery Services was fraudulently claiming medical debt for services she had never received and attempting to collect payment for fictional medical bills. Samantha contacted Healthcare Recovery Services to inform Davis that the medical debt had been verified as fraudulent, but Davis continued to insist that the debt was legitimate and pressured her for immediate payment. Samantha reported the medical billing fraud to the Consumer Financial Protection Bureau, her state's Attorney General office, and Regional Medical Center's Compliance Department. She learned that fake medical debt collection scams often target people with good credit who are likely to pay disputed bills quickly. The authorities explained that legitimate medical debt collection involves detailed billing documentation, coordination with healthcare providers, and proper validation of insurance processing before pursuing collection activities. Samantha learned that consumers have the right to request itemized medical bills and insurance explanations of benefits for all claimed medical services before making any payments to collection agencies. The experience taught Samantha to always verify medical debt claims directly with healthcare providers and insurance companies before making payments to collection agencies claiming to represent medical facilities. Samantha now educates others about medical billing fraud and emphasizes maintaining detailed healthcare records and verifying all medical debt claims through official medical and insurance channels. Marcus, a 35-year-old postal worker, received threatening phone calls about medical bills that would test his knowledge of healthcare billing laws and teach him valuable lessons about phantom medical debt scams. The callers claimed he owed money for ambulance services and emergency treatment he had never received. Marcus maintained his health through regular exercise and preventive care with his family doctor, and he had not required any emergency medical services or ambulance transportation in recent years. His health insurance through the Postal Service covered his routine medical care without any billing problems or outstanding balances. Marcus was careful about tracking his medical expenses and insurance coverage, and he would have remembered receiving emergency medical treatment or ambulance services that would result in substantial medical bills requiring collection efforts. The caller, who identified himself as Medical Collections Agent Robert Thompson from Emergency Services Billing, claimed that Marcus owed $3,600 for ambulance transportation and emergency room treatment provided 8 months earlier after a workplace accident. Mr. Jackson, you have an outstanding balance of $3,600 for emergency ambulance transport and trauma center treatment provided after your workplace injury on February 10th, Thompson said with apparent emergency medical services knowledge and workplace injury expertise. Thompson claimed that Marcus's workers' compensation insurance had denied coverage for the emergency medical treatment due to filing errors and that the ambulance company and hospital had referred his account to their collection agency for immediate payment. Mr. Jackson, when workers' compensation claims are denied, patients become responsible for all emergency medical costs, and these debts must be resolved quickly to prevent legal action. Thompson continued with apparent workers' compensation billing knowledge and legal consequence warnings. Thompson explained that Marcus faced potential wage garnishment and legal action if the medical debt was not resolved immediately, and that he could settle the account for $2,200 if payment was made within 48 hours. Marcus was confused because he had not been injured at work or received any emergency medical treatment, and he had never filed any workers' compensation claims or received any communications about denied insurance coverage. I haven't been injured at work or received any emergency medical treatment, Marcus explained to Thompson. Can you provide specific information about when and where this treatment supposedly occurred and documentation of the workers' compensation denial? Thompson became aggressive when Marcus questioned the medical debt, claiming that workplace injury victims often don't remember emergency medical treatment due to trauma and that questioning the debt would result in additional legal fees being added to his balance. Mr. Jackson, trauma victims frequently have memory gaps about their emergency medical treatment, but that doesn't eliminate their financial responsibility for the services provided. Thompson insisted with apparent trauma treatment knowledge and financial responsibility expertise. Thompson also threatened to contact Marcus's employer about the unpaid medical debt and workers' compensation issues, claiming that unresolved workplace injury debts could affect his employment status and benefits eligibility. Marcus felt intimidated by Thompson's aggressive tactics, but decided to research the medical debt claim and verify his workers' compensation status before making any payments. Marcus contacted his Postal Service Workers' Compensation Office to verify whether he had any workplace injury claims or medical treatment coverage issues and learned that he had no workers' compensation claims or coverage problems in their system. Marcus also contacted the ambulance company and hospital that Thompson claimed had provided services and learned that they had no patient records or billing information for him in their databases. Marcus contacted his health insurance company to verify his claims history and confirmed that no emergency room or ambulance services had been submitted or processed for his policy coverage. Marcus realized that emergency services billing was fraudulently claiming medical debt for services he had never received and attempting to use workers' compensation complications to create believable medical billing scenarios. Marcus contacted emergency services billing to inform Thompson that the fraudulent claims had been verified, but Thompson continued to insist that the medical debt was legitimate and threatened legal action if payment was not made immediately. Marcus reported the phantom medical debt scam to the Consumer Financial Protection Bureau, his state's Attorney General office, and his Postal Service Workers' Compensation Fraud Department. The authorities explained that legitimate medical billing involves proper documentation of services provided and accurate insurance processing before pursuing collection activities against patients. Marcus learned that workers should verify all workplace injury claims through official workers' compensation channels and should never make payments for medical services that cannot be documented through legitimate healthcare providers. The experience taught Marcus to verify all medical debt claims through official healthcare and insurance channels while being suspicious of collection agencies that cannot provide proper documentation of services provided. Marcus now educates other postal workers about medical billing fraud and emphasizes verifying all medical debt claims through legitimate healthcare providers and insurance companies before making any payments to collection agencies. Rebecca, a 31-year-old dental hygienist, received calls about medical collection that would test her understanding of healthcare billing and teach her valuable lessons about medical debt verification scams. The caller claimed she owed money for specialist consultations and diagnostic tests she had never received. Rebecca worked in the dental field and was knowledgeable about medical billing procedures through her professional experience. She maintained excellent health insurance and received regular preventive medical care from her primary care physician without any billing complications or outstanding balances. Rebecca had not been referred to any medical specialists or received any diagnostic testing beyond routine preventive care that was fully covered by her health insurance plan. She kept organized records of her medical appointments and would have remembered receiving specialized medical services. The caller, who identified herself as healthcare billing coordinator Lisa Wilson from Specialty Medical Collections, claimed that Rebecca owed $2,800 for cardiology consultation and diagnostic testing that had been provided 4 months earlier by Metro Heart specialists. Ms. Rodriguez, you have an outstanding balance of $2,800 for cardiology consultation, EKG testing, and stress test evaluation provided by Metro Heart specialists on June 20th. Wilson said with apparent cardiology billing knowledge and specific diagnostic test expertise. Wilson claimed that Rebecca's health insurance had denied coverage for the specialist services due to lack of proper referral documentation and that the cardiology practice had referred her account to their collection agency after multiple billing attempts. Ms. Rodriguez, specialist medical services require proper referral documentation for insurance coverage, and when referrals are missing, patients become responsible for the full cost of services. Wilson continued with apparent insurance referral knowledge and billing procedure expertise. Wilson explained that immediate payment was necessary to prevent the medical debt from affecting Rebecca's credit score, and that the cardiology practice was prepared to pursue legal action if the account was not resolved within 1 week. Rebecca was confused because she had never been referred to Metro Heart specialists or received any cardiology services, and her primary care physician had never indicated that she needed specialist consultation or cardiac testing. I've never been to Metro Heart specialists or received any cardiology services, Rebecca explained to Wilson. Can you provide documentation showing the referral from my primary care doctor and the insurance denial for these services? Wilson became evasive when Rebecca requested referral and insurance documentation, claiming that medical billing records were confidential and that she could only verify account information after receiving payment authorization from Rebecca. Ms. Rodriguez, due to HIPAA privacy regulations, I cannot share detailed medical billing information until you authorize access to your account records through our payment verification process, Wilson explained with apparent privacy regulation knowledge and authorization procedures. Wilson also claimed that the medical debt was approaching legal collection deadlines and that Rebecca would face additional attorney fees and court costs if she didn't resolve the account immediately. Rebecca felt suspicious about Wilson's privacy claims and decided to verify the medical debt independently through her healthcare providers and insurance company before making any payment decisions. Rebecca contacted Metro Heart Specialists directly to verify whether she had received any services and learned that she had no patient records or appointments in their system. Rebecca also contacted her primary care physician's office to verify whether she had been referred to any cardiology specialists and confirmed that no referrals had been made for her care. Rebecca contacted her health insurance company to review her claims history and verified that no cardiology services or specialist consultations had been submitted or processed for her coverage. Rebecca realized that Specialty Medical Collections was fraudulently claiming medical debt for specialist services she had never received and using legitimate medical terminology to create believable billing scenarios. Rebecca contacted Specialty Medical Collections to inform Wilson that the fraudulent claims had been verified, but Wilson continued to insist that the medical debt was legitimate and pressured her for immediate payment to avoid legal consequences. Rebecca reported the medical billing fraud to the Consumer Financial Protection Bureau, her state's Attorney General Office, and Metro Heart Specialists Compliance Department. The authorities explained that legitimate medical billing involves proper documentation of services provided, valid insurance processing, and coordination with healthcare providers before pursuing collection activities. Rebecca learned that healthcare professionals should use their medical knowledge to identify fraudulent medical billing claims and should always verify medical debt through direct contact with healthcare providers and insurance companies. The experience taught Rebecca to apply her professional healthcare knowledge to identify medical billing fraud and to help educate others about verifying medical debt claims through legitimate healthcare channels. Rebecca now educates patients and healthcare colleagues about medical billing fraud and emphasizes the importance of verifying all medical debt claims through direct contact with healthcare providers and insurance companies. Christopher, a 27-year-old firefighter, received phone calls about hospital bills that would test his understanding of emergency medical billing and teach him valuable lessons about fake medical collection scams. The caller claimed he owed thousands for emergency treatment after responding to a fire call. Christopher was a professional firefighter who understood emergency medical procedures through his training and experience. He maintained excellent health insurance through the fire department and had never required emergency medical treatment that would result in large outstanding medical bills. Christopher was physically fit and healthy from his firefighting training and had not been injured on duty or required any emergency medical treatment that would account for substantial hospital bills or collection efforts. The caller, who identified himself as Hospital Billing Agent Michael Torres from Emergency Medical Recovery, claimed that Christopher owed $5,400 for emergency room treatment and ambulance transport after being injured during a fire response 6 months earlier. Mr. Davis, you have an outstanding hospital bill of $5,400 for emergency trauma treatment and ambulance transport after your injury during the warehouse fire response on April 8th, Torres said with apparent emergency medical knowledge and firefighter injury expertise. Torres claimed that Christopher's fire department insurance had denied coverage for his emergency medical treatment due to policy exclusions for certain types of duty-related injuries, and that the hospital and ambulance company had referred his account for collection. Mr. Davis, fire department insurance policies often have exclusions for specific types of injuries, and when coverage is denied, firefighters become personally responsible for their emergency medical costs. Torres continued with apparent firefighter insurance knowledge and policy limitation expertise. Torres explained that Christopher faced potential legal action and wage garnishment if the medical debt was not resolved immediately, and that he could settle the account for $3,200 if payment was made within 72 hours. Christopher was confused because he had not been injured during any fire responses and had never received emergency medical treatment that would result in hospital bills or insurance complications. I haven't been injured on duty or received any emergency medical treatment, Christopher explained to Torres. Can you provide specific information about when and where this treatment supposedly occurred and documentation of the insurance denial? Torres became more aggressive when Christopher questioned the medical debt, claiming that firefighters sometimes don't remember emergency medical treatment due to smoke inhalation or trauma, and that questioning legitimate medical bills would result in additional collection fees. Mr. Davis, firefighters often experience memory loss during emergency situations, but that doesn't eliminate your financial responsibility for the medical treatment you received. Torres insisted with apparent firefighter medical knowledge and memory loss expertise. Torres also threatened to contact Christopher's fire department supervisor about the unpaid medical debt and insurance problems, claiming that unresolved medical bills could affect his employment status and benefits eligibility. Christopher felt angry about Torres's aggressive tactics and decided to verify the medical debt claim through his fire department and healthcare providers before taking any action. Christopher contacted his fire department's insurance coordinator to verify whether he had any workplace injury claims or medical treatment coverage issues, and learned that he had no injury reports or medical claims in their system. Christopher also contacted the hospital and ambulance company that Torres claimed had provided services and learned that they had no patient records or billing information for him. Christopher verified with his personal health insurance company that no emergency medical services had been submitted or processed for his coverage during the timeframe Torres had mentioned. Christopher realized that emergency medical recovery was fraudulently claiming medical debt for services he had never received and attempting to exploit his knowledge of firefighter injuries to create believable medical billing scenarios. Christopher contacted Emergency Medical Recovery to inform Torres that the fraudulent claims had been verified, but Torres continued to insist that the medical debt was legitimate and threatened immediate legal action. Christopher reported the medical billing fraud to his fire department's Fraud Investigation Unit, the Consumer Financial Protection Bureau, and his state's Attorney General office. The authorities explained that legitimate emergency medical billing involves proper documentation of services provided and accurate insurance processing before pursuing collection activities against patients. Christopher learned that public safety workers should verify all workplace-related medical claims through official department channels and should be suspicious of medical debt claims that cannot be documented through legitimate healthcare providers. The experience taught Christopher to use his professional knowledge to identify fraudulent medical billing claims and to help educate other firefighters about medical debt verification procedures. Christopher now educates other firefighters about medical billing fraud and emphasizes verifying all medical debt claims through official department channels and legitimate healthcare providers before making any payments to collection agencies. Angela, a 33-year-old bank teller, received threatening calls about medical laboratory bills that would test her knowledge of diagnostic billing and teach her valuable lessons about fake lab collection scams. The caller claimed she owed money for blood tests and diagnostic work she had never authorized. Angela was healthy and maintained regular preventive care with her family physician, including routine blood work and health screenings that were fully covered by her bank's health insurance plan. She had not received any additional laboratory testing that would result in outstanding bills or collection issues. Angela was organized about her health care and kept copies of all medical bills and insurance explanations of benefits to ensure that her medical expenses were properly handled and paid according to her insurance coverage. The caller, who identified herself as laboratory billing specialist Jennifer Hayes from Diagnostic Collections Network, claimed that Angela owed $1,900 for comprehensive blood testing and genetic screening that had been ordered by her physician 3 months earlier. Ms. Thompson, you have an outstanding laboratory bill of $1,900 for comprehensive metabolic panel, lipid screening, and genetic testing ordered by Dr. Martinez on July 15th, Hayes said with apparent laboratory billing knowledge and specific test expertise. Hayes claimed that Angela's health insurance had denied coverage for the laboratory testing due to medical necessity requirements, and that the lab had referred her account to their collection agency after multiple billing attempts. Ms. Thompson, insurance companies often deny coverage for preventive laboratory testing that doesn't meet their medical necessity criteria, leaving patients responsible for the full cost of diagnostic services. Hayes continued with apparent insurance denial knowledge and medical necessity expertise. Hayes explained that immediate payment was necessary to prevent the laboratory debt from being reported to credit bureaus and that additional collection fees would be added if the account was not resolved within 1 week. Angela was confused because she had not received any laboratory testing beyond her routine annual blood work, and she had never heard of the genetic screening tests that Hayes claimed had been ordered for her. I only had routine blood work done, and my insurance covered those tests, Angela explained to Hayes. Can you provide documentation showing what additional tests were supposedly ordered and why my insurance denied coverage? Hayes became evasive when Angela requested test documentation, claiming that laboratory billing records contained sensitive medical information that could only be released after payment verification and account authorization from Angela. Ms. Thompson, laboratory test results and billing information are confidential medical records that require patient authorization before they can be discussed or released, Hayes explained with apparent medical privacy knowledge and authorization procedures. Hayes also claimed that the laboratory debt was approaching legal collection deadlines and that Angela would face additional attorney fees if she didn't authorize payment immediately to resolve the account. Angela felt suspicious about Hayes's privacy claims and decided to verify the laboratory billing independently through her healthcare providers and insurance company before making any payment decisions. Angela contacted Dr. Martinez's office to verify what laboratory tests had been ordered and learned that only routine blood work had been requested, which had been fully covered by her insurance. Angela also contacted her health insurance company to review her laboratory claims and confirmed that no additional testing had been submitted for coverage beyond her routine preventive blood work. Angela contacted the laboratory that Hayes claimed had performed the testing and learned that they had no patient records or billing information for her in their system. Angela realized that Diagnostic Collections Network was fraudulently claiming laboratory debt for testing she had never received and using legitimate medical terminology to create believable billing scenarios. Angela contacted Diagnostic Collections Network to inform Hayes that the fraudulent claims had been verified, but Hayes continued to insist that the laboratory debt was legitimate and pressured her for immediate payment. Angela reported the laboratory billing fraud to the Consumer Financial Protection Bureau, her state's Attorney General office, and Dr. Martinez's office compliance department. The authorities explained that legitimate laboratory billing involves proper physician orders, accurate insurance processing, and coordination with healthcare providers before pursuing collection activities. Angela learned that patients should verify all laboratory billing claims through their healthcare providers and insurance companies and should request detailed documentation of any testing that they don't remember authorizing. The experience taught Angela to maintain detailed records of her healthcare services and to verify all medical debt claims through direct contact with her healthcare providers and insurance company. Angela now educates other bank employees about medical billing fraud and emphasizes the importance of verifying laboratory and diagnostic billing claims through legitimate healthcare channels before making payments to collection agencies. Daniel, a 39-year-old construction foreman, received calls about medical equipment bills that would test his understanding of durable medical equipment billing and teach him valuable lessons about medical supply fraud. The caller claimed he owed money for medical equipment he had never received or requested. Daniel was physically active and healthy from his construction work and had not required any medical equipment or devices that would result in billing or collection issues. His health insurance through the construction union covered his medical needs without any complications. Daniel had never been prescribed or received any durable medical equipment, such as braces, monitors, or therapeutic devices that would account for substantial medical bills or collection efforts from equipment suppliers. The caller, who identified himself as medical equipment billing agent Stephen Clark from Durable Medical Collections, claimed that Daniel owed $2,600 for back support equipment and pain management devices that had been prescribed following a workplace injury. Mr. Wilson, you have an outstanding balance of $2,600 for lumbar support bracing and TENS unit therapy equipment prescribed after your back injury on May 22nd, Clark said with apparent medical equipment knowledge and workplace injury expertise. Clark claimed that Daniel's workers' compensation insurance had denied coverage for the medical equipment due to treatment authorization issues, and that the medical supply company had referred his account to their collection agency for immediate payment. Mr. Wilson, when workers' compensation denies coverage for medical equipment, injured workers become personally responsible for the full cost of prescribed therapeutic devices. Clark continued with apparent workers' compensation knowledge and medical equipment billing expertise. Clark explained that Daniel faced potential legal action if the medical equipment debt was not resolved immediately, and that he could settle the account for $1,800 if payment was made within 5 days. Daniel was confused because he had not been injured at work or prescribed any medical equipment, and he had never filed any workers' compensation claims or received any medical devices from equipment suppliers. "I haven't been injured at work or received any medical equipment," Daniel explained to Clark. "Can you provide documentation showing the prescription for this equipment and the workers' compensation denial?" Clark became aggressive when Daniel questioned the medical equipment debt, claiming that construction workers often minimize their injuries and forget about medical equipment they've received due to pain medication effects. "Mr. Wilson, construction workers frequently don't remember receiving medical equipment because pain medications can affect memory, but that doesn't eliminate your financial responsibility for the devices provided," Clark insisted with apparent construction injury knowledge and medication effect expertise. Clark also threatened to contact Daniel's construction company about the unpaid medical equipment debt and workers' compensation issues, claiming that unresolved equipment bills could affect his employment and union benefits. Daniel felt frustrated by Clark's aggressive tactics and decided to verify the medical equipment debt through his union and healthcare providers before taking any action. Daniel contacted his construction union's workers' compensation coordinator to verify whether he had any workplace injury claims or medical equipment authorizations, and learned that he had no injury reports or equipment prescriptions in their system. Daniel also contacted the medical supply company that Clark claimed had provided equipment and learned that they had no customer records or billing information for him. Daniel verified with his personal health insurance company that no medical equipment claims had been submitted or processed for his coverage. Daniel realized that Durable Medical Collections was fraudulently claiming medical equipment debt for devices he had never received and attempting to exploit his knowledge of construction injuries to create believable billing scenarios. Daniel contacted Durable Medical Collections to inform Clark that the fraudulent claims had been verified, but Clark continued to insist that the equipment debt was legitimate and threatened immediate legal action. Daniel reported the medical equipment billing fraud to his union's Fraud Investigation Department, the Consumer Financial Protection Bureau, and his state's Attorney General office. The authorities explained that legitimate medical equipment billing involves proper physician prescriptions, accurate insurance processing, and delivery documentation before pursuing collection activities against patients. Daniel learned that construction workers should verify all workplace-related medical claims through official union channels and should be suspicious of medical equipment debt claims that cannot be documented through legitimate healthcare providers. The experience taught Daniel to use his professional knowledge to identify fraudulent medical billing claims and to help educate other construction workers about medical debt verification procedures. Daniel now educates other construction workers about medical billing fraud and emphasizes verifying all medical equipment debt claims through official union channels and legitimate healthcare providers before making payments to collection agencies. Patricia, a 44-year-old school nurse, received phone calls about surgical billing that would test her understanding of hospital billing procedures and teach her valuable lessons about phantom surgery collection scams. The caller claimed she owed money for outpatient surgery she had never received. Patricia worked as a school nurse and was knowledgeable about medical procedures and billing through her healthcare profession. She maintained excellent health insurance and had not required any surgical procedures that would result in outstanding hospital bills or collection issues. Patricia had received only routine preventive medical care and had never been scheduled for or received any outpatient surgical procedures that would account for substantial medical bills or collection efforts from hospitals or surgical centers. The caller, who identified herself as Hospital Billing Coordinator Amanda Foster from Surgical Collections Group, claimed that Patricia owed $6,800 for outpatient arthroscopic knee surgery that had been performed 7 months earlier at Metro Surgical Center. "Ms. Johnson, you have an outstanding surgical bill of $6,800 for arthroscopic knee surgery and anesthesia services provided at Metro Surgical Center on March 30th. Foster said with apparent surgical billing knowledge and procedure expertise. Foster claimed that Patricia's health insurance had denied coverage for the outpatient surgery due to pre-authorization requirements, and that the surgical center had referred her account to their collection agency after multiple billing attempts. "Ms. Johnson, outpatient surgical procedures require prior authorization from insurance companies, and when authorization is missing, patients become responsible for the full cost of surgical services. Foster continued with apparent insurance authorization knowledge and surgical billing expertise. Foster explained that immediate payment was necessary to prevent the surgical debt from affecting Patricia's credit score, and that the surgical center was prepared to pursue legal action if the account was not resolved within 2 weeks. Patricia was confused because she had never had knee problems or received any arthroscopic surgery, and she would definitely remember having any surgical procedures performed. "I've never had knee surgery or been treated at Metro Surgical Center," Patricia explained to Foster. "Can you provide documentation showing the pre-authorization denial and the surgical procedure records?" Foster became evasive when Patricia requested surgical documentation, claiming that operating room records and billing information were confidential medical records that could only be released after payment verification from Patricia. "Ms. Johnson, surgical procedure records and billing information contain sensitive medical information that requires patient authorization before they can be discussed or released," Foster explained with apparent medical privacy knowledge and authorization procedures. Foster also claimed that the surgical debt was approaching legal collection deadlines, and that Patricia would face additional attorney fees and court costs if she didn't authorize payment immediately. Patricia felt suspicious about Foster's privacy claims and decided to verify the surgical billing independently using her healthcare knowledge and professional resources. Patricia contacted Metro Surgical Center directly to verify whether she had received any procedures and learned that she had no patient records or surgical appointments in their system. Patricia also contacted her health insurance company to review her claims history and confirmed that no surgical procedures had been submitted or processed for her coverage. Patricia used her professional healthcare knowledge to recognize that legitimate surgical billing involves extensive documentation and insurance processing that Foster could not provide. Patricia realized that Surgical Collections Group was fraudulently claiming surgical debt for procedures she had never received and using legitimate medical terminology to create believable billing scenarios. Patricia contacted Surgical Collections Group to inform Foster that the fraudulent claims had been verified, but Foster continued to insist that the surgical debt was legitimate and pressured her for immediate payment. Patricia reported the surgical billing fraud to the Consumer Financial Protection Bureau, her state's Attorney General office, and Metro Surgical Center's compliance department. The authorities explained that legitimate surgical billing involves extensive pre-authorization documentation, detailed procedure records, and proper insurance processing before pursuing collection activities. Patricia learned that healthcare professionals should use their medical knowledge to identify fraudulent medical billing claims and should help educate others about verifying surgical debt through legitimate healthcare channels. The experience taught Patricia to apply her professional healthcare expertise to identify medical billing fraud and to help protect other healthcare workers and patients from similar scams. Patricia now educates patients and healthcare colleagues about medical billing fraud and emphasizes the importance of verifying all surgical debt claims through direct contact with healthcare providers and insurance companies. Kevin, a 32-year-old electrician, received threatening calls about physical therapy bills that would test his understanding of rehabilitation billing and teach him valuable lessons about therapy collection fraud. The caller claimed he owed money for physical therapy sessions he had never attended. Kevin maintained his physical fitness through his electrical work and recreational activities and had never required physical therapy or rehabilitation services that would result in billing or collection issues. His health insurance through the Electrical Workers Union covered his medical needs without complications. Kevin had not been injured or received any physical therapy treatments that would account for substantial rehabilitation bills or collection efforts from therapy providers or billing companies. The caller, who identified himself as rehabilitation billing agent Paul Martinez from Therapy Recovery Services, claimed that Kevin owed $3,100 for physical therapy sessions and rehabilitation services provided after a work-related back injury. "Mr. Brown, you have an outstanding balance of $3,100 for physical therapy evaluation and treatment sessions provided at Advanced Rehabilitation Center following your workplace back injury," Martinez said with apparent physical therapy knowledge and workplace injury expertise. Martinez claimed that Kevin's workers' compensation insurance had denied coverage for the physical therapy treatments due to treatment authorization issues, and that the rehabilitation center had referred his account to their collection agency. Mr. Brown, workers' compensation insurance often denies coverage for extended physical therapy treatments, leaving injured workers personally responsible for rehabilitation costs. Martinez continued with apparent workers' compensation knowledge and therapy billing expertise. Martinez explained that Kevin faced potential legal action and wage garnishment if the physical therapy debt was not resolved immediately, and that he could settle the account for $2,200 if payment was made within 1 week. Kevin was confused because he had not been injured at work or received any physical therapy treatments, and he had never filed any workers' compensation claims or visited rehabilitation centers. "I haven't been injured at work or received any physical therapy," Kevin explained to Martinez. "Can you provide documentation showing the injury report and the therapy treatment records?" Martinez became aggressive when Kevin questioned the physical therapy debt, claiming that electrical workers often don't report minor back injuries immediately and that physical therapy patients sometimes forget treatment sessions due to pain management medications. "Mr. Brown, electrical workers frequently develop back problems from their work activities, and pain medications can affect memory of physical therapy appointments," Martinez insisted with apparent occupational injury knowledge and medication effect expertise. Martinez also threatened to contact Kevin's electrical contractor about the unpaid physical therapy debt and workers' compensation issues, claiming that unresolved therapy bills could affect his employment and union standing. Kevin felt annoyed by Martinez's aggressive tactics and decided to verify the physical therapy debt through his union and healthcare providers before taking any action. Kevin contacted his electrical union's workers' compensation coordinator to verify whether he had any workplace injury claims or physical therapy authorizations and learned that he had no injury reports or therapy prescriptions in their system. Kevin also contacted Advanced Rehabilitation Center to verify whether he had received any services and learned that they had no patient records or treatment information for him. Kevin verified with his personal health insurance company that no physical therapy claims had been submitted or processed for his coverage. Kevin realized that Therapy Recovery Services was fraudulently claiming physical therapy debt for services he had never received and attempting to exploit his knowledge of electrical work injuries to create believable billing scenarios. Kevin contacted Therapy Recovery Services to inform Martinez that the fraudulent claims had been verified, but Martinez continued to insist that the therapy debt was legitimate and threatened immediate legal action. Kevin reported the physical therapy billing fraud to his union's Fraud Investigation Department, the Consumer Financial Protection Bureau, and his state's Attorney General office. The authorities explained that legitimate physical therapy billing involves proper physician referrals, detailed treatment documentation, and accurate insurance processing before pursuing collection activities. Kevin learned that electrical workers should verify all workplace-related medical claims through official union channels and should be suspicious of therapy debt claims that cannot be documented through legitimate healthcare providers. The experience taught Kevin to use his professional knowledge to identify fraudulent medical billing claims and to help educate other electrical workers about medical debt verification procedures. Kevin now educates other electrical workers about medical billing fraud and emphasizes verifying all physical therapy debt claims through official union channels and legitimate healthcare providers before making payments to collection agencies. Nancy, a 41-year-old insurance agent, received calls about prescription drug bills that would test her understanding of pharmacy billing and teach her valuable lessons about medication collection fraud. The caller claimed she owed money for expensive medications she had never received or ordered. Nancy worked in the insurance industry and understood medical billing procedures through her professional experience helping clients with healthcare claims. She maintained excellent prescription drug coverage and had never received any expensive medications that would result in outstanding pharmacy bills. Nancy filled her prescriptions regularly at her local pharmacy and had never received any specialty medications or expensive drugs that would account for substantial pharmacy bills or collection efforts from medication suppliers. The caller, who identified herself as pharmacy billing specialist Susan Miller from Prescription Recovery Network, claimed that Nancy owed $4,500 for specialty medications that had been prescribed and delivered to her home 6 months earlier. Ms. Mitchell, You have an outstanding pharmacy bill of $4,500 for specialty diabetes medications and insulin delivery systems that were prescribed by Dr. Richardson and delivered to your residence," Miller said with apparent pharmacy billing knowledge and specialty medication expertise. Miller claimed that Nancy's prescription drug insurance had denied coverage for the specialty medications due to formulary restrictions and that the specialty pharmacy had referred her account to their collection agency for immediate payment. Ms. Mitchell, specialty medications often require prior authorization and formulary approval, and when insurance denies coverage, patients become responsible for the full retail cost of prescription drugs. Miller continued with apparent insurance formulary knowledge and specialty pharmacy billing expertise. Miller explained that immediate payment was necessary to prevent the prescription debt from being reported to credit bureaus and that additional collection fees would be added if the account was not resolved within 48 hours. Nancy was confused because she was not diabetic and had never been prescribed diabetes medications or insulin, and she would definitely remember receiving expensive specialty medications at her home. "I don't have diabetes and have never been prescribed insulin or diabetes medications," Nancy explained to Miller. "Can you provide documentation showing the prescription from Dr. Richardson and the insurance denial?" Miller became evasive when Nancy requested prescription documentation, claiming that medication records and billing information were confidential medical records that could only be released after payment authorization from Nancy. Ms. Mitchell, prescription drug records contain sensitive medical information that requires patient authorization and payment verification before they can be discussed or released, Miller explained with apparent medical privacy knowledge and authorization procedures. Miller also claimed that the prescription debt was approaching legal collection deadlines and that Nancy would face additional attorney fees if she didn't authorize payment immediately to resolve the account. Nancy felt suspicious about Miller's privacy claims and decided to use her insurance industry knowledge to verify the prescription billing independently through healthcare providers and insurance channels. Nancy contacted Dr. Richardson's office to verify whether she had been prescribed any diabetes medications and learned that she had no patient records or prescription history with that physician. Nancy also contacted her prescription drug insurance company to review her medication claims and confirmed that no specialty diabetes medications had been submitted or processed for her coverage. Nancy used her professional insurance knowledge to recognize that legitimate specialty pharmacy billing involves extensive prior authorization documentation that Miller could not provide. Nancy realized that Prescription Recovery Network was fraudulently claiming prescription debt for medications she had never received and using legitimate pharmaceutical terminology to create believable billing scenarios. Nancy contacted Prescription Recovery Network to inform Miller that the fraudulent claims had been verified, but Miller continued to insist that the prescription debt was legitimate and pressured her for immediate payment. Nancy reported the prescription billing fraud to the Consumer Financial Protection Bureau, her state's Attorney General office, and her state's insurance regulatory agency. The authorities explained that legitimate prescription billing involves proper physician prescriptions, insurance processing, and delivery documentation before pursuing collection activities against patients. Nancy learned that insurance professionals should use their industry knowledge to identify fraudulent medical billing claims and should help educate clients about verifying prescription debt through legitimate healthcare channels. The experience taught Nancy to apply her professional insurance expertise to identify medical billing fraud and to help protect her clients from similar prescription collection scams. Nancy now educates insurance clients about medical billing fraud and emphasizes the importance of verifying all prescription debt claims through direct contact with healthcare providers and insurance companies. Gregory, a 36-year-old mechanic, received phone calls about mental health billing that would test his understanding of behavioral health services and teach him valuable lessons about psychiatric collection fraud. The caller claimed he owed money for counseling sessions and psychological evaluations he had never received. Gregory was mentally healthy and had never required counseling services or psychological evaluations that would result in billing or collection issues. His health insurance through the Automotive Workers Union covered his medical needs, including mental health benefits, without complications. Gregory had not received any mental health treatment or counseling services that would account for behavioral health bills or collection efforts from psychology practices or mental health billing companies. The caller, who identified himself as Mental Health Billing Coordinator William Hayes from Behavioral Collections Services, claimed that Gregory owed $2,400 for individual counseling sessions and psychological evaluation provided after a workplace stress assessment. Mr. Adams, you have an outstanding balance of $2,400 for counseling sessions and psychological evaluation provided at Community Mental Health Center following your workplace stress evaluation, Hayes said with apparent mental health billing knowledge and workplace assessment expertise. Hayes claimed that Gregory's health insurance had denied coverage for the mental health services due to treatment authorization requirements, and that the mental health center had referred his account to their collection agency. Mr. Adams, mental health services often require prior authorization from insurance companies, and when authorization is denied, patients become responsible for the full cost of counseling and evaluation services. Hayes continued with apparent insurance authorization knowledge and mental health billing expertise. Hayes explained that immediate payment was necessary to prevent the mental health debt from affecting Gregory's credit score, and that confidential counseling records would remain private if the account was resolved quickly. Gregory was confused because he had never received workplace stress evaluation or mental health counseling, and he had never visited Community Mental Health Center for any psychological services. I've never received mental health counseling or been to Community Mental Health Center, Gregory explained to Hayes. Can you provide documentation showing the workplace evaluation and the treatment authorization denial? Hayes became evasive when Gregory requested treatment documentation, claiming that mental health records were extremely confidential and could only be accessed after payment verification and account authorization. Mr. Adams, mental health treatment records are protected by strict confidentiality laws, and I cannot discuss specific counseling details until you authorize access through payment verification, Hayes explained with apparent mental health privacy knowledge and authorization procedures. Hayes also claimed that the mental health debt was approaching collection deadlines, and that Gregory would face legal action if he didn't resolve the account within 72 hours. Gregory felt suspicious about Hayes's privacy claims and decided to verify the mental health billing independently through his union and healthcare providers. Gregory contacted his automotive union's employee assistance program to verify whether he had received any workplace stress evaluations or mental health referrals and learned that he had no records in their system. Gregory also contacted Community Mental Health Center to verify whether he had received any services and learned that they had no patient records or treatment information for him. Gregory verified with his health insurance company that no mental health claims had been submitted or processed for his coverage. Gregory realized that Behavioral Collections Services was fraudulently claiming mental health debt for services he had never received and attempting to exploit confidentiality concerns to avoid providing documentation. Gregory contacted Behavioral Collections Services to inform Hayes that the fraudulent claims had been verified, but Hayes continued to insist that the mental health debt was legitimate and threatened legal action. Gregory reported the mental health billing fraud to his union's Employee Assistance Program, the Consumer Financial Protection Bureau, and his state's Attorney General office. The authorities explained that legitimate mental health billing involves proper referrals, treatment documentation, and insurance processing while maintaining appropriate patient confidentiality protections. Gregory learned that workers should verify all mental health claims through official employee assistance programs and should be suspicious of counseling debt claims that cannot be documented through legitimate mental health providers. The experience taught Gregory to recognize fraudulent mental health billing and to help educate other workers about verifying behavioral health debt through legitimate healthcare channels. Gregory now educates other mechanics about medical billing fraud and emphasizes verifying all mental health debt claims through official union channels and legitimate healthcare providers. Lisa, a 30-year-old teacher, received calls about imaging service bills that would test her understanding of diagnostic imaging billing and teach her valuable lessons about radiology collection fraud. The caller claimed she owed money for MRI scans and X-rays she had never received. Lisa maintained excellent health through regular exercise and preventive care with her family physician, and she had never required diagnostic imaging services that would result in radiology bills or collection issues. Her teacher health insurance covered her medical needs without billing complications. Lisa had not received any MRI scans, CT scans, or X-rays that would account for substantial imaging bills or collection efforts from radiology centers or imaging billing companies. The caller, who identified herself as radiology billing agent Jennifer Walsh from Imaging Collections Group, claimed that Lisa owed $3,700 for MRI brain scan and cervical spine imaging that had been performed 5 months earlier. Ms. Roberts, you have an outstanding radiology bill of $3,700 for brain MRI and cervical spine imaging provided at Advanced Imaging Center on June 10th, Walsh said with apparent radiology billing knowledge and diagnostic imaging expertise. Walsh claimed that Lisa's health insurance had denied coverage for the imaging services due to medical necessity requirements, and that the imaging center had referred her account to their collection agency for immediate payment. Ms. Roberts, diagnostic imaging requires medical necessity documentation for insurance coverage, and when necessity criteria aren't met, patients become responsible for the full cost of radiology services. Walsh continued with apparent insurance necessity knowledge and imaging billing expertise. Walsh explained that immediate payment was necessary to prevent the imaging debt from being reported to credit bureaus and that additional collection fees would be added if the account was not resolved within 1 week. Lisa was confused because she had never experienced symptoms that would require brain or spine imaging, and she had never been to Advanced Imaging Center for any diagnostic procedures. I've never had brain or spine problems or received any MRI scans, Lisa explained to Walsh. Can you provide documentation showing the physician order for this imaging and the insurance denial? Walsh became evasive when Lisa requested imaging documentation, claiming that radiology records and billing information contained sensitive medical information that required patient authorization before release. Ms. Roberts, diagnostic imaging records contain detailed medical information that requires patient authorization and payment verification before they can be discussed or released, Walsh explained with apparent medical privacy knowledge and authorization procedures. Walsh also claimed that the imaging debt was approaching legal collection deadlines, and that Lisa would face additional attorney fees if she didn't authorize payment immediately. Lisa felt suspicious about Walsh's privacy claims and decided to verify the imaging billing independently through her healthcare providers and insurance company. Lisa contacted her family physician to verify whether she had been referred for any brain or spine imaging and learned that no imaging referrals had been made for her care. Lisa also contacted Advanced Imaging Center to verify whether she had received any services and learned that she had no patient records or imaging appointments in their system. Lisa verified with her health insurance company that no diagnostic imaging claims had been submitted or processed for her coverage. Lisa realized that Imaging Collections Group was fraudulently claiming radiology debt for services she had never received and using legitimate medical imaging terminology to create believable billing scenarios. Lisa contacted Imaging Collections Group to inform Walsh that the fraudulent claims had been verified, but Walsh continued to insist that the imaging debt was legitimate and pressured her for immediate payment. Lisa reported the radiology billing fraud to the Consumer Financial Protection Bureau, her state's Attorney General office, and Advanced Imaging Center's Compliance Department. The authorities explained that legitimate diagnostic imaging billing involves proper physician orders, medical necessity documentation, and insurance processing before pursuing collection activities. Lisa learned that patients should verify all imaging debt claims through their healthcare providers and insurance companies and should request detailed documentation of any diagnostic procedures they don't remember receiving. The experience taught Lisa to maintain detailed records of her healthcare services and to verify all medical debt claims through direct contact with her healthcare providers and insurance company. Lisa now educates other teachers about medical billing fraud and emphasizes the importance of verifying diagnostic imaging debt claims through legitimate healthcare channels before making payments to collection agencies. Anthony, a 43-year-old plumber, received threatening calls about home healthcare bills that would test his understanding of home medical services and teach him valuable lessons about home care collection fraud. The caller claimed he owed money for nursing services and medical equipment delivered to his home. Anthony was healthy and independent, managing his plumbing business and personal activities without requiring any home healthcare services or medical assistance. His health insurance covered his medical needs without any complications or billing issues. Anthony had never received home nursing care, medical equipment deliveries, or home healthcare services that would account for substantial bills or collection efforts from healthcare agencies or medical supply companies. The caller, who identified himself as home healthcare billing agent Robert Chin from Medical Home Collections, claimed that Anthony owed $5,200 for nursing services and medical equipment provided at his home after a surgical procedure. Mr. Garcia, you have an outstanding balance of $5,200 for skilled nursing visits and medical equipment rental provided at your residence following your surgical discharge from Metro Hospital, Chun said with apparent home healthcare knowledge and post-surgical care expertise. Chin claimed that Anthony's health insurance had denied coverage for the home healthcare services due to discharge planning requirements, and that the home health agency had referred his account to their collection agency. Mr. Garcia, home healthcare services require proper discharge authorization from hospitals, and when authorization is missing, patients become responsible for the full cost of nursing care and equipment rental. Chun continued with apparent discharge planning knowledge and home healthcare billing expertise. Chun explained that immediate payment was necessary to prevent the home healthcare debt from affecting Anthony's credit score, and that medical equipment would be retrieved if the account was not resolved within 48 hours. Anthony was confused because he had never been hospitalized or received any surgical procedures that would require home healthcare services or medical equipment at his residence. I haven't been hospitalized or received any home healthcare services, Anthony explained to Chun. Can you provide documentation showing the hospital discharge and the home care authorization? Chun became aggressive when Anthony questioned the home healthcare debt, claiming that post-surgical patients often don't remember home care services due to medication effects and recovery stress. Mr. Garcia, patients recovering from surgery frequently have memory gaps about their home healthcare services due to pain medications and recovery stress. Chin insisted with apparent post-surgical knowledge and medication effect expertise. Chin also threatened to contact Anthony's plumbing customers about the unpaid healthcare debt and to retrieve medical equipment from his home if payment was not made immediately. Anthony felt angry about Chin's aggressive tactics and decided to verify the home healthcare debt through his insurance company and local hospitals. Anthony contacted his health insurance company to verify whether any home healthcare claims had been submitted or processed for his coverage and learned that no home care services appeared in his claims history. Anthony also contacted Metro Hospital to verify whether he had been a patient requiring home healthcare discharge planning and learned that he had no patient records in their system. Anthony verified that no medical equipment had been delivered to his home and that no home healthcare agencies had contacted him about services. Anthony realized that Medical Home Collections was fraudulently claiming home healthcare debt for services he had never received and attempting to exploit his knowledge of post-surgical care to create believable billing scenarios. Anthony contacted Medical Home Collections to inform Chun that the fraudulent claims had been verified, but Chun continued to insist that the home healthcare debt was legitimate and threatened immediate equipment retrieval. Anthony reported the home healthcare billing fraud to the Consumer Financial Protection Bureau, his state's Attorney General office, and his health insurance company's fraud department. The authorities explained that legitimate home healthcare billing involves proper hospital discharge planning, physician orders, and insurance authorization before providing services or pursuing collection activities. Anthony learned that patients should verify all home healthcare claims through their insurance companies and healthcare providers, and should be suspicious of collection agencies claiming services that cannot be documented. The experience taught Anthony to recognize fraudulent medical billing and to help educate other independent contractors about verifying healthcare debt through legitimate medical channels. Anthony now educates other plumbers about medical billing fraud and emphasizes verifying all home healthcare debt claims through insurance companies and legitimate healthcare providers before making payments to collection agencies. Michelle, a 38-year-old social worker, received calls about psychiatric hospital bills that would test her understanding of inpatient mental health billing and teach her valuable lessons about psychiatric facility collection fraud. The caller claimed she owed money for psychiatric hospitalization she had never experienced. Michelle worked in mental health services and understood psychiatric treatment procedures through her professional experience helping clients access behavioral health services. She had never required inpatient psychiatric treatment that would result in hospital bills or collection issues. Michelle maintained her mental health through professional self-care practices and had never been hospitalized or received inpatient psychiatric treatment that would account for substantial hospital bills or collection efforts. The caller, who identified herself as Psychiatric Billing Coordinator Lisa Morgan from Mental Health Recovery Services, claimed that Michelle owed $8,900 for inpatient psychiatric treatment and medication management provided during a 72-hour evaluation hold. Ms. Davis, you have an outstanding psychiatric hospital bill of $8,900 for inpatient evaluation and medication adjustment provided at Behavioral Health Hospital during your 72-hour assessment period, Morgan said with apparent psychiatric billing knowledge and involuntary hold expertise. Morgan claimed that Michelle's health insurance had denied coverage for the psychiatric hospitalization due to medical necessity requirements, and that the psychiatric hospital had referred her account to their collection agency. Ms. Davis, psychiatric hospitalization requires extensive medical necessity documentation for insurance coverage, and when necessity criteria aren't met, patients become responsible for the full cost of inpatient treatment. Morgan continued with apparent insurance necessity knowledge and psychiatric billing expertise. Morgan explained that immediate payment was necessary to prevent the psychiatric debt from being reported to credit bureaus and that confidential treatment records would remain private if the account was resolved quickly. Michelle was confused because she had never been psychiatrically hospitalized or placed on any type of evaluation hold, and she would definitely remember any inpatient mental health treatment. I've never been psychiatrically hospitalized or placed on an evaluation hold, Michelle explained to Morgan. Can you provide documentation showing the admission orders and the insurance denial? Morgan became evasive when Michelle requested hospitalization documentation, claiming that psychiatric treatment records were extremely confidential and could only be accessed after payment verification. Ms. Davis, psychiatric hospital records are protected by strict confidentiality laws, and I cannot discuss specific treatment details until you authorize access through payment verification, Morgan explained with apparent mental health privacy knowledge and authorization procedures. Morgan also claimed that the psychiatric debt was approaching legal collection deadlines, and that Michelle would face additional attorney fees if she didn't resolve the account within 24 hours. Michelle felt suspicious about Morgan's privacy claims and decided to use her professional mental health knowledge to verify the psychiatric billing independently. Michelle contacted Behavioral Health Hospital to verify whether she had been a patient and learned that she had no patient records or admission history in their system. Michelle also contacted her health insurance company to verify whether any psychiatric hospital claims had been submitted or processed for her coverage and confirmed that no inpatient mental health services appeared in her claims history. Michelle used her professional knowledge to recognize that legitimate psychiatric billing involves extensive documentation and legal procedures for involuntary holds that Morgan could not provide. Michelle realized that Mental Health Recovery Services was fraudulently claiming psychiatric debt for services she had never received and attempting to exploit confidentiality concerns to avoid providing documentation. Michelle contacted Mental Health Recovery Services to inform Morgan that the fraudulent claims had been verified, but Morgan continued to insist that the psychiatric debt was legitimate and pressured her for immediate payment. Michelle reported the psychiatric billing fraud to the Consumer Financial Protection Bureau, her state's Attorney General office, and Behavioral Health Hospital's Compliance Department. The authorities explained that legitimate psychiatric billing involves proper admission procedures, medical necessity documentation, and insurance processing while maintaining appropriate patient confidentiality protections. Michelle learned that mental health professionals should use their clinical knowledge to identify fraudulent psychiatric billing and should help educate others about verifying mental health debt through legitimate healthcare channels. The experience taught Michelle to apply her professional mental health expertise to identify medical billing fraud and to help protect other mental health workers and clients from similar scams. Michelle now educates mental health clients and colleagues about medical billing fraud and emphasizes the importance of verifying all psychiatric debt claims through direct contact with healthcare providers and insurance companies.